it has been incredibly helpful to know that there are other people going through similar experiences. At the time I was 52 years old, I was, as far as I knew, perfectly fit and healthy. I am a mom of 2 boys, and my SCAD happened on a Saturday morning when I was getting ready to drive my son to a soccer tournament. My husband was at work that morning. We're both physicians. As I was blow drying my hair, I suddenly developed this really excruciating chest pain, which I thought was heartburn, and I hadn't really eaten anything, so the timing was unusual and the intensity was much different than anything I had experienced before. And I ran around my bathroom and my bedroom taking heartburn medications. I took a whole bunch of things and nothing made it better. And I yelled for my son, who was then 15 years old, and he called my husband, and my husband says, "I'm sure she's fine. I just talked to her 5 minutes ago." My son said, "Should I call 911?" And the 2 of us simultaneously said no. And my son, for whatever reason, some great instinct that he had, he insisted on calling 911 and was very clear and direct. And we walked downstairs to wait for the ambulance to come, and I told him to call back and cancel it because maybe I was feeling a little better, and he refused. And then the paramedics came, and I told them that I was a physician and I was having heartburn and some kind of a panic attack, and they could leave. And thankfully they refused, and said that if I would just step into the ambulance for a minute, they would do a 12-lead EKG, and if that was okay, then they would leave. So they carried me out of my house onto the sidewalk in a little carry chair, and then let me off on the sidewalk and said I could step into the ambulance. And that's the last thing I remember, is holding on to the ambulance stairway and saying, "I feel dizzy." And then I woke up to hear the paramedics on their walkie-talkies telling the hospital about how she was in VFib and shocked and returned to normal sinus rhythm. And I sat up and I said, "Are you talking about me?" We took the few-minute drive to the hospital, and when we arrived in the emergency room, I was mostly blind. By then my husband had gotten home, and he and my son were there in the emergency room, and you know, I remember just saying, "I can't see, I can't see." And then I immediately was taken for a series of CT scans and an angiogram, and then was told that they found nothing, and that they didn't know what happened, but probably wasn't going to be anything to worry about because everything looked fine. And subsequently, later that night, about half an hour after my husband went home to go to bed, I called him back and I said, "It's happening again." I said, "You have to come back." And they still treated me, I was in the intensive care unit, but they still treated me as if I didn't have a heart condition, despite the fact that I had had a cardiac arrest. And they had a crash cart next to my bed. But when the same symptoms happened, they gave me Mylanta. My troponins were extremely elevated, and they wrote that off to the fact that I had had CPR. So they thought that the CPR caused some cardiac injury, and that's what caused the troponins to go up. So they were willing to overlook absolutely everything. The troponins, the cardiac arrest, the ventricular fibrillation, the subsequent period of blindness. They said it was all nothing. The next day, they were still prepared to discharge me without a diagnosis. And I arranged my transfer to a different hospital and had a cardiac MRI, which showed that I had had a large myocardial infarction. And the team at the new hospital looked at my angiogram and saw the SCAD. A couple days later, I had an defibrillator placed to prevent further cardiac arrests if it was to happen again. And honestly, since then, I have really been fine. I think part of it is confirmation bias. I think that women in general are taken less seriously when they present with cardiac symptoms. And even I myself as a physician wasn't really willing to take myself seriously at first either. I really only owe my 15-year-old son Eli the credit for being the one to take it seriously, and certainly the one who saved my life. I think there is some increased awareness in cardiology circles of SCAD, and I think a lot of that is due to the work that's been published in the last couple of years, which I think has really helped raise some awareness of SCAD in the cardiology circles. But I still don't think that in emergency rooms and in the general medical community, most people really have never heard of it. I really don't think that anything would have changed between 4 years ago and now. I think the thing with diagnosing SCAD is that it has to be something that you would even consider in order to find it. It is unlikely to just show itself or be maybe so overtly obvious. When I spoke to the cardiologists at the first hospital and asked them to look at the angiogram again, they still didn't note the SCAD, but they did say that I had, quote, curly coronary arteries, which should have been a signal to them to look for SCAD, because almost all SCAD patients have what are called tortuous or curly coronary arteries. A couple years ago, I had the opportunity to meet and thank the first responders who saved my life by doing CPR and using an external defibrillator. And that was really, really an amazing, awesome experience. I'm so grateful to them and to my son. And it was really moving for me to find out how much my experience meant to those first responders. I think the biggest thing that I would want medical professionals to know about SCAD is to be gentle, that angiograms should be done gently, and invasive procedures like stents should be done only when absolutely 100% necessary. And I think that often the procedures that people do with good intentions turn out to make things worse. So actually, in that regard, I am grateful that the people at the first hospital misdiagnosed my SCAD, because if they had seen the blockage and gone in there to try to stent it, they certainly could have made things much worse. And as it went, as far as I know, it healed itself.